Good evening. How are you guys? My name is Dr. Amin. I work with NMC Hospital, the one in Rui. There are other branches that we have as well, in Hale and in Ghubra. I work with the emergency department. I've had a discussion about coronavirus on another group day before yesterday, and we have had quite a number of people come in and discuss something which was really important, and we had some really good questions. Now, this is another opportunity that we can get into the misconceptions or myths surrounding coronavirus as the number of patients in Oman is rising. I'm sorry I haven't used my Facebook in a very long time. It's been years. And I just got on this just so that I could actually get the message across. It's been a very, very long, grilling week. It has been too much work, too less sleep. um, we are going to start this session with something which is that I've noticed along the way in the hospital and in the clinics, that I've seen a lot of patients coming in and, you know, doing this. How many of you actually wear gloves to the hospital? Now, a lot of people say that they've gotten their information from different sources regarding gloves, and gloves is something that they should be wearing when they're going out, or this is going to save them. And what about masks? A lot of people wear masks for coronavirus. The reason I'm not discussing what coronavirus is, how it spread, what happened, what's happening around the world, is because right now, on a snap of a finger, a lot of people have had enough information regarding what it is, how it is, where it is, so on and so forth. I'm talking about a lot of things that, since we are in the middle of it now, that we can actually figure out what are the things to do and what are not the things to do, and what to stay away from. The first and the far most important thing that I have to tell you guys is to please make sure that you use your information collection from the proper sources. Ministry of Health websites are there. If you actually go to the Ministry of Health Oman's website, it'll give you a lot of information. It has different portions for the general public, for the healthcare worker, because they have been working quite a bit day in and day out to help out the general public, fighting this problem that has now emerged as a community transmission. We are in the phase where we have actually seen that certain people that had no history of travel have been infected by people who have been diagnosed with COVID-19. Um, a lot of messages on social media, on news, on radio has been circulating, and it's been quite loudly informed that you need to have something called social distancing and to stay home. Sadly, some people are still not following it. Sometimes when I'm going to the hospital, I notice that I still find some people roaming about. Shops are still open, and people are still sitting outside it. The concept of social distancing and isolation, and why we need to do it, is not really, it hasn't really seeped into a lot of people's everyday life. They haven't really understood why it's important and why they're doing it. So let's come down to some of the basic myths that we've been talking about. For example, gloves. I've noticed a lot of people wearing gloves, and to be honest, I think in our country at the moment, we're not at that level where we need to wear gloves in certain areas. And I have my own hesitations regarding gloves. So in certain countries, when the hand sanitizers ran out, okay, they had no other option left but to wear gloves. So that kind of makes sense, because if you go out for grocery shopping or something like that, then obviously you need something to protect your hand. But inadvertently, what actually happens is, because your hand feels protected, and I'm talking about the general public, as far as a healthcare worker is concerned, we have a completely different system, training, and subconsciously we have actually developed this method of figuring out how to actually use our things so that it doesn't cause any hazards to us and to the patients. But to the general public, when they wear gloves, I've noticed they use it as if they're using their hands. The concept of gloves and its wearing completely goes away. So, for example, if you have gloves on, you feel safe. You feel that, okay, my hands and the skin of my hands is not touching anything, and therefore I cannot get the virus. The virus doesn't get through your skin, okay? You don't get infected through your skin. You get infected when this virus, which is on your hands, actually ends up in your nose or in your mouth, or you do this, or you do this, or you do this. With the gloves on, you've touched so many surfaces, and you've done this, and that's it. The virus is now in a place where it wanted to be in the first place. So I don't really recommend that people wear gloves unless they are in certain professions. The ministry has actually outlined, they have painstakingly outlined each and every profession, okay, that where you need to wear gloves, where you need to wear masks, and everything. So please get your information right. Don't use WhatsApp and Facebook as your only source of information. Okay? I am a healthcare worker. I've been doing this for years. And there are a lot of things that I do that are natural reflexes now. But I had to be trained into this system for a while to actually use these gloves in a particular way. So what is recommended if you don't wear gloves? What is recommended is that you use hand sanitizers and you wash your hands frequently. Because once you think that you're safe and you're not in danger by wearing gloves, because you feel that way, because this is the message that you've gotten from the internet, from the social media, okay, that okay, you're wearing gloves and now the virus will not get attached to your skin. Yes, agreed, it will not get attached to your skin, but as soon as you put your hand onto your face like this, that's it, it's there. So I recommend, and what WHO recommends, and what the Ministry of Health Oman recommends, okay, is that you wash your hands. You use hand sanitizers as frequently as possible. If you come in contact with surfaces which have a high ratio of touch, so for example, doorknobs of supermarkets or your own house or offices or clinics, you go there, the doorknobs are cleaned by the special cleaners that the hospitals hire. So as soon as you touch something like that, sanitize your hand. Use a 90% alcohol gel, or there are other industrial strength sanitizers available as well. For example, Sterilium, you have that. So they are available in the market as well. Use these. Wash your hands, use your hand sanitizer, do all of these things, okay? Then comes the big question, masks. Okay. As far as masks are concerned, okay, I have now noticed that people who need the masks the most, me and my staff, are really struggling to keep the stocks up. We are using masks because we are in contact with not one, not two, but many, dozens and dozens of patients in a shift. I'm talking about numbers sometimes reaching up to 100. Meeting 100 people in 8 hours, okay, I need to change my mask and my gloves and my personal protective equipment many times. And at this point, when half the population of the country has taken masks in bulk quantities, guess who's suffering? Guess who cannot protect himself? I'm in direct contact with my patients. I get sick, I'm off the workforce, you have one less doctor now to take care of you. So a lot of people think that it protects you. I'm sorry, but I'm going to actually try to break it down and explain what each mask actually is for and what it does. So the common masks that I've seen people wearing cloth masks. So Lubna just asked me, is covering face with scarf help to keep us safe from exposure to virus while going for grocery? You have to understand size does matter. Okay? So viruses are very, very small, 0.3, 0.4, 0.5 microns. These are tiny, tiny, tiny particles. And a cloth is basically a woven piece of, stitched piece of cloth. So it has pores and gaps that are too big. Viruses are just one small tiny part. It won't even stop bacteria. Different papers have shown, whether directly or because you are somebody who's that safe or obsessive compulsive, that you wash your hands frequently. If somebody's wearing a mask in general population during non-COVID time, let's say, all right, if you are somebody like that, then people who wear these cloth masks have a 75% less incidence of flu. Whether this paper was biased or not, we're not really sure. It just shows a lesser incidence. As far as the masks are concerned, as far as these cloth masks are concerned, I really do not recommend them. They don't really benefit you in any way. They will probably, if somebody spits on your face, block a part of that spit from the cloth, but it will seep through eventually because it's not a hydrophobic surface. What does a hydrophobic surface mean? It doesn't repel water, it absorbs it. It's sponge. So it really doesn't work. Then you've seen surgical masks. I've seen now surgical masks run out completely from the market. It's really hard to get your hands on them. We are lucky that the Ministry of Health Oman has given us certain suppliers that still are bringing in stock from other places, and we are trying to replenish our stocks as much as possible in NMC. So far we're okay, but when and if, God forbid, the demand rises further, if we see more sick people, there are more sick people joining in to the hospital and getting admitted, we will start depleting these masks quite at a rapid rate. And that time we might actually have a problem. At this point, no, we're fine. We're just getting by. But my question is, does anybody who even wears a surgical mask in the non-medical community, who's not a healthcare worker, even know why and how this mask was manufactured and what it was for? The pores, it's a non-woven cloth, okay? So it's not something that has been stitched in, okay? It's a synthetic polyester, okay? And it has a pore that is so small that, let's say, for example, a bacteria wanted to cross through it, then part of it won't. A surgical mask is actually used, if I am sick, then my saliva, my droplets don't get you infected. So if I'm wearing a mask, it means that I am probably sick, and that's why I don't want you to get sick. As far as the healthcare workers are concerned, their flus and their sicknesses are much stronger. We're always exposed to different type of viruses and bacteria, and the general public isn't really exposed to those as much. So if I wear the mask, it's because I don't want my germs, especially during surgeries or procedures, my germs don't cause an infection to the patient. What does it protect me from in a hospital? So if I'm sitting in a hospital and I'm seeing a patient, what does it really do for me? I know that it does something for you if I'm wearing it, but what does it do for me? What it does for me is that if, say for example, I see a sick patient and he's sneezing or coughing, then the bigger droplets will actually come onto the mask and not cross. Okay, but the viruses, they will still end up crossing a bit. Plus, it doesn't fit properly. So the surgical mask, which is like a rectangle, like this, okay, it has space here and here. It doesn't fit properly. So the viruses or bacteria can enter from all sides. So it doesn't really protect me as much. That's why you have the social distance. You keep a distance even if you're wearing a mask so that you don't get infected with the direct droplets that are coming through a cough or a sneeze. Then I've seen people wear this big mask called the N95. Actually, there are more. There's N95, 99, N100. Then there is FPP2, 1, 2, and 3. The name N95, N99, N100 is given according to the viral particles or protection that it gives you in percentage wise. So for example, it says N95, it is 95% protective. The dilemma is that the virus, coronavirus, COVID-19, is maybe 0.125 to 0.2 microns, whereas the N95 mask can barely filter less than 0.5. Okay, these are really tiny particles. There are chances even with that it will seep through, and therefore you are hearing stories about healthcare workers who are in direct contact with patients getting sick. It doesn't give me 100% protection, but I still do my duty. I still do my work. I get there and I wear it. Gives me some protection, but I get it done. Who should wear that? I've seen people actually deplete that from the market, and I felt so sorry. The reason is you are not somebody who is going to be in contact with a patient in a very close personal space. You understand? Somebody's private space. You're not going to invade that. As a health practitioner, I do it every day with every patient. I look at their throat, I look at their nose, so I'm in very close proximity to them. So if a patient is COVID-19 and I'm in such a close proximity to him or her, okay, there is a chance that a part of their droplets or virus or bacteria will end up into my nose and mouth, and I will probably end up getting infected. The N95 mask gives me some protection. 99 and 100 are there as well. Have you tried wearing that mask for 8 hours? It is not easy. By the end of your shift, okay, if you have a very heavy load or you're taking care of a COVID patient and you're in full protective gear, your throat is going to hurt. Do you have any idea what a nurse who is taking care of a COVID-19 patient actually goes through? She has to wear, or he has to wear, a full protective gear for 6 to 8 hours, which means once they're in, 6 to 8 hours they cannot eat, drink, or use the washroom. That is how hard the job actually is. That is how hard it is to take care of a COVID-19 patient. But that is the need of the hour, and they're standing up to it. They're standing up to the call. They're going there. They're doing all of this. So people who have ended up using N95 masks in parks or on roads, you're not even, 3 meters closer to somebody. It's of no use to you, but it makes me and my job and my life a lot more easier if I have it, because I am in direct contact with these patients in a very close proximity. I have to take their cultures or throat swabs or everything like that, and all of this information actually exists. Like I said, you need to collect your information from the right sources. The Ministry of Health pages are filled with this information. Who needs to use what mask and what gear to wear, at what given time. Go to the WHO.int site. It explains explicitly who and which person and healthcare provider in what circumstances will use what mask. We are short of these protective equipment around the world. We might not have it that bad right now here, but around the world where the cases are in thousands, can you imagine what each one of those healthcare workers is going through? All right, let's take a few questions. How many times N95 mask can be used? Oh, excellent question. I had that question. I asked it to my anesthetist, Dr. Hari. He's our team leader in the hospital, and we have a special COVID-19 team in NMC Specialty Hospital, Rui. And we are planning ahead of time. We are preparing ourselves ahead of time. We are planning so well, and we have done so much work in order to safeguard our lives, our families' lives, and the patients that come in. So I asked him that question, how many times can we use it once it falls, short in the market? There's a special way to clean it. A lot of people will try to wash it and that's it. Once you wash that mask, it's gone. It's of no use. At a given time, 4 to 6 hours in one go, you can use it, and you cannot touch it. You can't fiddle with it. You can't scratch it. You can't touch its surface. It fits right here, and it's a tight fit. You actually have to go through a fitting test in order to use this mask in the healthcare setting. If you're somebody who cannot fit the mask properly on his face, if you have a long beard, or if the mantle is not good enough, if your chin is a little short, okay, you have to use a separate device, not just a mask. It's called a respirator, external respirator. Can you imagine? Now, N95, when it fits right here, it completely blocks in and out from the sides, from up here, everywhere. It's blocked in. The effort it takes to breathe in, and some of them have valves in there, so it's a little better to breathe out, but some of them don't. So it's really hard. By the end of the use, our throats hurt, our skin here is chafing, it's really hard. And once we run out, after a patient is done, we actually have to throw it away. But in those circumstances, if it is short in the market and those are the only 5, 10, 15 pieces you're left with, what do you do? There is a special solution that you make with hypochlorous acid. Okay, you put it in a spray in a very diluted quantity, very diluted, and you hang the mask in air and you just spray it out and let it dry. What they have done is they have tested it out, how much can it filter each one of those reuses with the hypochlorous acid. On 30th use, it was pretty much useless. So what is recommended, that in dire circumstances, if it's really that hard, 20 times with those solutions, sprayed in a particular way, dried in a particular way, and then eventually after drying stored in another particular way, it can be probably used 20 times, and that's stretching it to the maximum. Okay, so good question. I hope you get what you got the answer what you were looking for. Thank you for doing this. Hope this is a relevant question. Not sure if I missed a part about the introduction, etc. Will basic all-purpose kitchen cleaners be enough to clean grocery items before putting them away, or does it have to be a disinfectant spray? Then thank you and stay safe. Thank you. So this is a question that was asked by Nuzha. There are these regular disinfectants available in the supermarket. Those are good enough. You don't really have to go out of your way and buy yourself industrial strength disinfectants. No, you don't need it. A lot of people are having issues. Okay, disinfectants are not there in the market anymore. Not in Oman, but in other countries. Let's suppose you're in that situation where A, either you can't afford a disinfectant in the supermarket, or B, you don't have it in the supermarkets anymore. What do you do then? Bleach. A diluted form of bleach is good enough to clean surfaces. Can we clean groceries? There is an actually really interesting video out on, and I shared it with my family the other day as well, on YouTube, about this one doctor who's in Michigan. He actually showed how to clean your groceries once you get them, and it has a very meticulous method. It's very time consuming, but it's something for people who can actually save themselves the trouble of spoiling their food while trying to clean it. So yeah, there are regular disinfectants available in the supermarket, and those are good enough. And if you don't have them, then you can use hypochlorous acid or something called Clorox, bleach. How to disinfect grocery items, as we do not know we have touched them or infected them. Lubna, as I talked to you before about this, yes, the grocery items, there are some items that are really easy to disinfect, right? I talked about it in the previous group as well, the day before yesterday, I think it was. Glass surfaces, jars, and all of those things, they can be disinfected with a small bleach item if no bleach has the tendency to seep into that particular grocery, or disinfectant, regular one is good enough, or an alcohol rub is good enough. All of these are good enough to disinfect surfaces which are non-absorbent, right? For example, glass surfaces, so you have jars and everything else. So, and then it comes to cardboards. So notice something about cardboards. Go to the supermarket and buy anything in a cardboard. You will notice that the cardboard is just the external decoration. Okay, it's just surface outside. The package inside is in plastic. So you can basically open the cardboard, dump it out. All right, you don't really need to touch it, and that's it. That's clean. So the cardboard, which has probably been touched by people looking at groceries, is no longer a problem because it's no longer on your grocery shelf. Yeah? Fruits and vegetables. Um, some recommend soap washing. Some recommend just adding a little bit of vinegar in water and washing them with that. Either is okay. Adding vinegar and washing your fruits with that in water, diluted soap in soapy water, that is good enough, as long as it's not something that will seep in and stay there. And obviously thoroughly washing it after that as well, because you don't want to eat some soap and cause diarrhea. That's a big problem. Don't we have problems like that? Okay. Someone talking sense. I'm really proud that I am actually listening to this. Thank you, Aisha. The symptoms of having COVID-19 consist of fever, dry cough, and hard time breathing. Does it mean all of the above or one of each? So I think, and I'm guessing, it's Ekniv Bolanos. Ekniv, I hope I'm pronouncing your name right. I'm sorry if I'm not. Echniv or Ekniv. That is somebody who has seen a Ministry of Health Oman's paper regarding who fits the criteria and needs to be tested for COVID-19. So the criteria is very simple, and I'll give you a straight away guideline of exactly who will be tested and who will not be. Because a lot of people for no reason are coming into the red zone. The house, home, green zone, safe. Okay? Offices, not so safe. Hospitals, dangerous. Red zone, because we'll be dealing with these patients. Yeah? If it's not necessary to come to the hospital, don't. If it's an emergency, we're there. We'll take you. So a lot of people are coming in and asking these questions. Can we be tested for COVID-19? The criteria is so simple. Go to the Ministry of Health website. They have the criteria outlined for everyone to see. So if you're a patient who has had a sudden onset of cough, runny nose, fever, okay, but you have additional things to it. A, you're a traveler. You're somebody who has traveled in the last 14-15 days. Okay? Or you are somebody who has been in a cluster of people who are sick. Okay? Or you are in direct contact with a patient of COVID-19. You're somebody whose loved one is sick and you're taking care of them. And now you have developed cough, runny nose, and fever. And the last, if you have cough, runny nose, and fever, and you are a healthcare worker. Yeah? Because we do see a lot more of people with cough, runny nose, and fever than anybody else. So these people will be tested. If you are not a person who has direct contact with a COVID-19 patient, if you're not a person who's in a cluster of sick people, if you're not a patient who has traveled in the last 14-15 days, if you're not a patient who's a healthcare worker, you're fine. Now, a lot of people ask me this question, how do I know if I have come in contact with a COVID-19 patient? And that is why we're saying stay home. Because neither you nor I will know if you have or have not come in contact with a COVID-19 patient while community transmission is going on. Stay home. Stay home. Okay. Summon Mirza Beg, no problem. You can just listen. Okay. I would like to thank you for everything you all are doing day and night. You all are real heroes. May Allah protect you. Ameen. Doctors, we always think that borders, but you all are protect all the borders. Oh God. But you all are protecting us in the hospitals. Thank you, Summon. Thank you, Aisha, for a happy Doctor's Day wish. Do you need a checkup?
You missed her initial comment.
Did I miss her initial comment? Emma. Actually, I can't see that comment,
She
Emma.
said, what do you do when you come out of quarantine?
All right. Thank you, Sheila, for the Doctor's Day wish. In kindergarten, Saman Mirza Beg. Good work, Saman. But I think kindergarten is off. Yeah. So, what did she ask for?
Um, what happens when you come out of quarantine?
What happens? Oh, so there is an isolation procedure and there is a de-isolation procedure. These are things meant for us to know, but since the general public is very curious, there are certain things that we can tell you, and it's very easy to disclose this because it's information that is open. It is available online. It is not something that is hidden. The people that we actually isolate, for example, somebody who has come in on a special flight, okay, while these airports are closed, is quarantined. The word quarantine is no longer used. We say isolated. When we say isolated, we mean that he goes into a room with an attached bathroom and he's not allowed to come out of it for 14 days. There's going to be somebody who's going to be taking care of them, okay? And they're going to be constantly checking up on them. And the private hospitals, health institutions, as well as the government hospitals and health institutions will follow these patients. So if a patient has come into a private sector hospital, I will follow them, or my staff, or my crew that is dealing with COVID-19. If it's a public sector hospital that they've gone into, they will follow them. Now, they will be tested as well on the 7th to the 10th day. If symptoms develop, okay, they will be tested as well. If they come out to be positive, they will be given treatment at home, preferably, because it's mild. 86% of the people will not require admission. It's a small percentage that will end up requiring admission, and a very small percentage of those admitted patients that will get serious, and a very small percentage of those people who are getting very serious that will be ventilated mechanically, on a ventilator, if you can put it that way. So, let's suppose you're one of the patients who was isolated, tested out to be positive, okay, the healthcare workers are following you, and they're looking at you and your symptoms, and your test was positive, and they're taking care of you with small medications, minor medications, and your progress is very good, and comes to a point where 3 days without medication or any support, you have 0 symptoms. You are now ready for de-isolation. In some countries, they will test you again at de-isolation. In Oman and in other countries, it is not recommended. So in our particular case, once you are symptom-free for 72 hours, you're good to be de-isolated, and instructions will be actually given to you that you are good to be de-isolated. Okay? So it is something that you can actually follow through. You have to understand the system is very, tight-knit. It's very closed. So if somebody thinks that they're going to be in isolation and get away with it by going here and there, I'm sorry, it will not happen. You are asked about and visited on random checks by us and the ministries, okay? And we follow through with what we say. So to de-isolate, what happens at the end of isolation? You're good to go out, which means out of your room, but not out of your house. You still stay home. Okay. What if pick up in the supermarket won't fit this way? Okay, what if we pick it up in the supermarket? We won't fit the criteria. Asia Ahmed. Asia said, will we fit in the criteria if we pick it up from the supermarket? No. Certain cashiers who are there may come into that contact, but on a very strong suspicion, they will fit into the criteria. The criteria only outlines healthcare workers as a profession, which needs to be tested. Other patients are followed symptomatically, what their symptoms are and what needs to be done according to the development of those symptoms. The reason why this sounds slightly monotonous is because I've said again and again, if you stay home, you won't pick it up. But if you find an excuse to go out and do not take the precautions that the ministry has asked you for taking, you will end up getting it. So if you go to the supermarket, one person goes. Not your grandmother, not your grandfather, not your mama, papa, brother, sister, uncle, aunt, everybody else gathering up in the supermarket to buy one thing. No, no. One person from the household who lives in your home needs to go to the supermarket, and then he needs to take the precautions: trolley handles, hand sanitizers. If at that time you want to use gloves, I'm okay with it as long as you don't touch your face. But other than that, gloves don't make a difference, and sanitizers and hand washing does. So the chances of you picking up something from the supermarket are very small if you take precautions. I got exposed to someone who tested positive, but now it's been 18 days with no symptoms. Am safe, or could I get it now? Grace Abu Divan Sawaya. If you have come in contact with a person who has COVID-19, you are probably a person who has been contacted by the ministry, because any person who comes out to be positive in Oman, okay, is contacted not just by themselves only, but their close contacts are contacted as well. It's a very meticulous process. It's very closely followed. So they will jot down every person that has come in contact with that positive patient, and they will follow them through in the isolation phase, and they will be isolating the person that has come in contact. And then they will decide on the 14th or the 15th day whether this person needs to be tested or not. Can you be asymptomatic carrier, somebody who has the virus but doesn't display any symptoms? 3% of the world's population is going to be like that. That is usually the case with most of the viruses. Small percentage of people will show no symptoms, but if you test them, they'll turn out to be positive. They are somebody who can infect other people, okay, but themselves, they will have no problems. That's why the quarantine phase is there. That's why they say that you need to stay in up till the point where the quarantine or isolation or these orders of social distancing are taken away, so that you don't end up infecting other people. Grace, if you actually follow through with the instructions, you will keep yourself and other people safe, and you will never need to be tested. As far as antibodies for these asymptomatic carriers are concerned, is this somebody who can eventually get sick or die or something like that? Just like people who will develop symptoms, asymptomatic carriers will eventually develop antibodies and get rid of the virus from their body as well. So this is something that is, something reassuring, that if you haven't gotten it now, you're fine. Okay? Stay safe. Thanks for answering us. Hi, Doc. Rez. Thank you, Rez. One more question. It's Echnev or Eknev. I'm sorry, I still can't pronounce your name. One more question. Are the declared number of people who are infected every day got the virus from the other related cases, cause their number keeps rising every day? I know that it started from Iran flight that came. Okay. Eknev, if you actually go to the ministry website and their declarations and what they have sent out as information, and they're very open about it, by the way. They haven't hidden anything. They have been very, very clear on their numbers. They have been very clear on how these numbers are rising. So yes, you are right that initially it was travel-related infections. It was infections coming in with the travelers. You're right. That is how it started out. And that's when the orders came in to stay home, not to go out unnecessarily for no reason. That is when they said, do not come out, don't go to the picnic spots, don't go here, don't go there. Then started the second cycle, where we found a few clusters that were travelers, and then the second cycle where people who were taking care of these patients that tested positive, who were relatives, loved ones, healthcare workers. So people who were very close contact with them. These patients' loved ones then ended up getting it. Okay? So the ministry, in their declarations regarding the numbers and everything, they have notices that come out. Notice 1, 2, 3. I think we're at notice 32 now, I think. I'm sure in 32. Is it 31 or 32 or maybe 33? I'm not sure. So each one of those notices actually tells you these many patients were related to travel. It was from Iran and USA, UK, Italy, um, some other countries as well. So some of these countries have been named and they have been coming from there. And some of these have been told in the notice itself that these many number of cases were from direct contact with COVID-19 patients as caretakers, right? And the remaining, which are under investigation, probably picked it up from the community. And that's why we're kind of nervous, a little bit, because now it's community transmission. Now it just makes a lot much more sense to stay home, because if we do not follow directives, if we actually do not listen to what is being asked of us to break the chain, so if one person gets infected, the one in front of him gets infected, the one in front of him gets infected, everybody comes out to the cinema, they're getting infected, and what ends up happening, one person decides to stay home. And there are people ahead of him who will probably say, okay, there's a gap here. So because of him not going out, he has stopped the disease at that point. So you need to understand, social distancing doesn't necessarily mean, to maintain a distance alone. You also have to self-quarantine. I know it's hard. I'm probably going to get shot in the next few days because my wife has been indoors for 3 weeks. If you don't hear from me, you know what happened. So it's really hard. It's not easy. Not going out, not seeing the sky. I know I don't have that kind of an opportunity where I can stay in. I still get up every day, 5:30, 5:45. I'm at the hospital in the morning. I'm there for a while. I don't have the freedom to choose that. My profession requires me to be there at any cost. There are so many rules coming in. I mean, can you imagine there are healthcare workers that have not met their families in 2-3 months in other countries because they are in direct contact with these patients, and there's a possibility that they have to maintain that distance and if they get it. So some of these healthcare workers will be at the hospital and they'll be then quarantined later on, and then only after they test out to be negative and everything is fine, they'll be allowed to go home. So some doctors will end up, or nursing staff will end up, staying away from their families for a month. Some may take longer, some may not come back. That is a possibility. So every time I leave the house is just an unsure thing. Maybe this time I'm not coming back. Maybe it'll be a month, maybe it'll be more, maybe it won't happen. Prevent many ways. What can we do at home for our body becomes more strong? If in case we get the virus, our body can fight with the virus, what can we do? Sheila, good question. What can we do? PlayStation? That's a thing. There is a lot of, I think now, videos and things saying that you can use Ayurvedic things, and this and that, and you should, eat this and eat that to stay strong and build up your immunity. I will not disagree with them, but it's not my science, so I can't really comment on it. But I can tell you something. I have some information about it, so I'll give you that much information. Eating healthy, sleeping healthy, which means sleep on time, wake up on time, even if you're at home. And, exercises which can be done within the household. If you have a treadmill, use that. If you have a, stepper, you can use that. If you have, a small gym in the house, you can use that. If none of that is there, there's an app. It's called Nike NTC. All right. So if you go online on Apple or on Google Play, you will actually find that app there, Nike NTC, and it tells you if you're a beginner or if you're somebody who's intermediate or somebody who's an expert, and you can actually train yourself in all of these things at home without using equipment. There are some exercises without using equipment. So exercise, eat healthy, sleep healthy, and this should keep you balanced, and your body should be healthy that way. If you eat well, they say you are what you eat. That's why I look like a cake. When we do, what if you were asked to isolate at home? Is there a checkup? Emma, I think I answered that question just now. Yes, there is a checkup if you're isolated at home, and there's a follow-up both from the private setup as well as the government setup. So and it is sometimes physical, sometimes verbal, like over the phone. Uh, After 14 days of quarantine, if you have no symptoms, it means you are safe unless you got it after quarantine period. Ah, okay, Lubna. How will you get it if you stay home? You won't get it if you stay home. But hypothetically, let's suppose you're one of those rebellious ones and you actually ended up going out. And yes, obviously you can get it. But you have to understand I'll try to make it as simple as possible for everyone out there. So your immunity, your antibodies, I want you to imagine two of them. Okay, there are so many of them, but I want you to just think about two of them. One is called IgG, and the other is called IgM. Let's not talk about all the others that are there. Just talk about two of them. Okay. Patient X got a virus that came into him on day 0. Okay. On day 0 to the day he develops symptoms is called what you call incubation period. Okay, incubation period. Now that is what you see physically outside on the patient, but what is happening inside his blood? What is happening to the antibodies? So as soon as that virus goes in, okay, your body recognizes it as foreign and it starts building antibodies after recognition against it. The first antibodies that rise up are IgM, which means the infection is acute, it's happening now. While 7 to 10 days of this infection have passed, 6th or 7th day, the IgG levels start rising up. So what does IgG do? IgG, immunoglobulin G, is long-term immunity, which means these antibodies will be inside you, and the next time around this virus comes in, it can't do anything to you because they're already there. It's long-term immunity. So once you are infected, cured, then you won't get sick again. So if you are infected after the isolation period, okay, after the quarantine period, it's probably because you got it after. But if you develop no symptoms after and everything else is fine, then you're okay. Then it's okay.
She was replying to Grace. Who said that? It's been 18 days.
Thanks, following all that. I am the person designated to shop. Haven't been out for 2 weeks, but will have to go, but next week. Asia, stay strong, man. Stay strong. You'll be fine. Ali Henshaw. Or it's Ali. It's Ali Henshaw. Okay, I'm pregnant 26 weeks. Congratulations! I assume same precaution when I go for hospital checkup. Supermarket, I am not going to supermarkets. Husband goes alone with all usual precautions. Many thanks. Good, Ali. Good to hear that somebody is following instructions. Good work. Good work. We have Sai, who recommended testing as much population as possible. Is Oman also following the strategy? Who did not recommend something like that? They cannot and will not recommend something like that. They have said that every country has their own model, and they have given instructions regarding what comes in what numbers when you get patients and what kind of a society you have. What is the imagine Somalia has 10, I think, patients so far. Somalia, 10 patients, I think, COVID-19. They do not have the resources to check every single person. There was a town in Italy with a population of, I think, 25 or 3,500. Okay. They found 1 or 2 patients with COVID-19. They locked the town down from other parts of Italy. The mayor actually isolated it. And they tested everybody. 3% of the population was asymptomatic carriers, which were causing the infection. They put it on a lockdown, everything was fine. That's 3,500, manageable. 5 million people that need to be tested, I don't think that's physically possible, okay, in a short time. By the time, I want you to imagine the timeline. I want you to think about it, okay? So you went into Muscat and you started the process from Rui of checking somebody. And by the time you reached Seeb or Barka, okay, Seeb or Barka, somebody in Rui got infected. Somebody in Rui. You cannot keep testing and going back. There has to be a smarter way of handling this. And Oman is following the smarter way, by the way. They have, I have to give them credit where it's due. You have to understand, Oman has taken steps to prevent this kind of an outbreak much earlier and much in advance. They are taking precautions much before they're needed. It's just the people need to comply. They have asked on multiple levels and multiple times. I mean, there are two type of kids. One of the kids, you tell him once and he listens, and the other one you have to beat down. Let's not be the kids that need to be beat down, right? The reason I've asked is 11 people were arrested today because they didn't follow quarantine, so some could be walking around those places, infected others. And hence, Asia, that is why you stay home. That is why you stay home, because you don't know who's going to break quarantine. And, well, they have no idea what's coming towards them. Grace, thank you. Asima Khalim, how can we protect ourselves while at work when we have no choice to stay home and required to work? I think I am the most qualified person to answer this, Asma. All right, because I don't have that choice either. The government has actually given the directives of cutting the workforce down to 30%. Okay, which means not cut 30%, cut 70% and make 30% work for the basic work. The rest of you work from home. A lot of people will not have that freedom. A lot of companies will not understand that. If you notice, the admin of this group had posted a number earlier, I think yesterday it was, or was it early morning today, about the numbers you can call if somebody is not following directives of the Supreme Committee. Okay? If you are falling under that circumstances, there are numbers. The government is there out to help you. It's not to be scared of. If there's something you feel that is wrong, they'll step in. There were certain companies that had cut the salaries down half because business wasn't as much. The Supreme Committee and Ministry of Manpower and everybody intervened and they helped them out. The decision to cut the salary was taken back. The ministry is out there to help. It's trying its best and the resources that it has. Okay? So if you are one of those unlucky people who will still have to go to work, precautions: hand washing, okay, hand sterilization, protecting yourself with a distance. If there's a client you deal with, keep him at a 1.5 meter or more distance. Meet somebody for the recommended time. Minimize your meetings, your gatherings, your office meetings down to a minimum. Ministry has abandoned sign-ins and thumbprints for signing in. There's a culture of trust that needs to be developed between corporates and its employees. Our hospital has done that. We don't need to sign in anymore. Our healthcare workers, nurses, other staff members don't need to do that anymore. Why? Because it cuts down infection rates. If there is somebody sick in the office, all you have to do is give them a mask, tell them to go home. If you're sick, go home. Just go home. Tell your manager, supervisor, boss, whoever, if you're the boss, stay away from your company. Because you don't want somebody else to cause sickness to you. Similarly, you don't need to cause sickness to other people. Okay? What we do, we have a really long day because of multiple number of reasons, because COVID has changed quite a bit of how we work. So every morning, other than the fact that my desk and my room is cleaned up by a professional cleaner every morning, even then, every single doctor in our hospital makes it a point that when they come in, the first thing that they do is by themselves, on their own, with special equipment, clean out their desks and equipment that they need to use for the patients. Blood pressure apparatus, cuffs, thermometers. They clean out the entire surface, keyboard, mouse, okay, everything that they can come in contact with, they clean it out. Okay? Make it a habit. When you go to your workstation, clean it out. There are cleaning materials available, disinfectants available in supermarkets. That is good enough to use. Okay? I hope that answers the question, and I hope you get to work in cycles, and some of the weeks you will be there, some of the weeks your colleagues will be there. people are having food from restaurants. Is that safe? Shouldn't that be closed, or is it safe? The packing around the food can be unsafe, Zabi. It can be. But the food inside can be taken care of. There have been studies on other coronaviruses, not this one, not COVID-19, but other coronaviruses on food and microwaving them. So if you actually microwave your food that comes in from the delivery area or the restaurant or wherever you get it from, that'll probably end up destroying most of the virus or all of it if you actually microwave it properly. But as far as the containers are concerned, don't use the utensils from outside, don't use the handkerchiefs from outside, the containers, all of that, discard all of that. Okay. Hopefully that should solve the problem, and you can actually do what everybody else used to do centuries ago: wash your hands before you eat your food. Okay. Die out in the summer. Admin asks, will the virus die out in the summer? Currently, there has been quite a bit of testing done for figuring out whether temperature rise causes any effect on the virus. You see, it doesn't matter if we are in 50 degrees Celsius. I want you to think about it from multiple perspectives, okay? I'm not going to give you an answer on one perspective. I'm going to actually divide it down for different ways for you to understand this. Has anybody ever heard of something called MERS-CoV, or Middle Eastern Respiratory Syndrome coronavirus? It is a virus that existed in camels that live in the desert, where the temperature is sometimes up to 50s, okay? If the virus can survive that temperature and then enter into a human being, and then obviously it'll survive as well, it'll survive. Now, you can look at it from that perspective that no, summers will not do it because it can probably survive 50 degrees. But I want you to look at it from another perspective. Your body's temperature is 37, okay? So let's suppose you went into an area which was cooler because there was air conditioning there, and the virus was there. Now it has entered into your nose or throat or gone into your lungs, and now you have something called coronavirus, COVID. Now you went out into the street under 50 degrees of Celsius. The virus is protected by you now inside your body, and the temperature is 37. It's not going to die. It isn't going to die. Maybe if it is on a metal surface or something that can be heated up to that level, it'll die out there. But inside you, even if it's 100 degrees outside, it will not die out. So thinking that, summer will destroy it, I have my hesitations. I'm not really sure about other people's observations on this, but it is something that needs to be thought about. These are things that have come up on social media related to the myths regarding this virus, but I don't really have much of an opinion other than this one on it. Anyways, guys, I hope this has been a really informative session for you. Let us know if there is more that you want to hear from us. Let the admin know. She will contact me as she lives with me. So, hopefully this information is something that you can use later on. And, information is completely useless if you keep it with yourself. You need to spread it. You need to tell other people about it. And stop flooding the corridors of the hospitals if you have a cough without any contact history. Oh wow, okay, suddenly certain people woke up. Namita goes, how to deal with supermarket shopping. I just answered that. Thank you very much, and thanks to your wife too. You're welcome, Emma. I hope you guys stay safe, stay indoors, and I hope that we come out of this stronger. And in times of need like this, there are a lot of people who are going to go without salaries sometimes because of business related issues. It's not something that we can control. It's happening around the world. If there's somebody you can help out just by giving information, give information. If there's somebody that you can help out by physically going and helping them out, keep the distance and help them out. But at the most important thing that you need to do is just stay indoors and take care of yourself and your loved ones. And that way you can take care of me. All right, guys, take care. Bye bye.